So, at the start of this year, something pretty dramatic happened in American healthcare. A financial safety net that millions of people relied on, well, it just vanished. We're talking about the end of a really critical support system that helped a record number of people afford health insurance. And the fallout? It's happening right now.
And believe me, we're already seeing the fallout. This number, 1.5 million, that's how many people dropped their Affordable Care Act health plans in just the first few weeks of this year. This data comes from the Centers for Medicare and Medicaid Services, and it's really our first real glimpse of just how big this impact is. So you've got to ask, right? Why this sudden cliff? Why is this happening now? What on earth changed between the last year and this year to cause such a massive reversal in healthcare coverage? Well, the answer lies in a single, pretty powerful concept. It all comes down to something called the subsidy cliff. This is the core reason for these soaring costs and dropping coverage numbers. And to really get what's happening to millions of Americans, we first have to understand what these subsidies actually were.
Okay, so what exactly is this subsidy? The easiest way to think about it is like a government-funded discount coupon for your health insurance. Starting back in 2021, the federal government began offering these much more generous financial aids, and they dramatically lowered the monthly premium payments for people buying insurance on the ACA marketplace. Honestly, for a lot of people, it made coverage affordable for the very first time.
So let's just quickly walk through how we got here. These enhanced subsidies were first introduced back in 2021. For the next few years, they fueled this huge expansion in healthcare coverage. But here's the catch. They were always designed to be temporary, and they officially expired at the end of last year, creating the very cliff that we're talking about now.
And you know what? While these subsidies were active, the impact was absolutely massive. They didn't just help a few people here and there, they really triggered a nationwide coverage boom, pushing the number of insured Americans to an all-time high. I mean, just look at the difference here. It is night and day. Before these enhanced subsidies were introduced, say from 2015 to 2021, ACA enrollment was pretty flat. But as soon as those subsidies kicked in, enrollment just skyrocketed. Just look at the scale of this growth. It's incredible. By the beginning of this year, the number of people signed up for ACA plans had more than doubled, hitting a record 21.3 million people. Health experts are pretty clear on this. They directly credit these subsidies with dramatically cutting down the number of uninsured Americans. But, of course, that boom is over. And now, millions of Americans are facing the consequences. That record enrollment is now leading to a very sudden, and for many, a very painful reality check. This quote from KFF, which is a major health policy research group, really says it all. We're not talking about a small price hike. For the average person who is getting this help, their monthly insurance bill is set to more than double. All of a sudden, what was a manageable expense is now a major financial burden. And that kind of financial shock, well, it's projected to have a staggering effect. An estimate from the Urban Institute suggests that by the end of this year, 4.8 million people could lose their health coverage completely, all because these subsidies are gone. And it's not just about people becoming totally uninsured either. There's this whole ripple effect. The Urban Institute also projects that another 2.5 million people will drop their ACA plans and scramble to find other options, maybe through an employer or Medicaid. And a lot of others will stay on the marketplace, but downgrade to plans with really high deductibles. Which, yeah, means lower monthly bills, but it could also mean huge out-of-pocket costs if they actually get sick. And that risk it's not a small thing at all. As this quote from the Bipartisan Policy Center points out, with healthcare costs rising everywhere, skipping out on good insurance means you're facing the very real possibility of a medical bill that could be financially crippling. So you can see, this isn't just about kitchen table economics. It's blown up into a massive political fight. The expiration of these subsidies has created a really high-stakes debate in Washington, with a political landscape that might just surprise you. So you might be wondering, where did all this growth actually happen? Well, the answer is probably not what you'd expect. According to a KFF analysis, an overwhelming 88% of all the new people who signed up since 2020 came from states that voted for Donald Trump in the last presidential election. Let's put some numbers to that because they are pretty wild. Enrollment shot up by 157% in Trump voting states. Compare that to a 36% increase in states that voted for Harris. In places like Texas, Mississippi, and West Virginia, enrollment actually more than tripled. That really complicates the simple political narrative, doesn't it?
And that political complexity? Yeah, it's playing out right now in the halls of Congress. On one side, you have Democrats who have been pushing hard to extend these subsidies and make them permanent. On the other side, the vast majority of Republicans have opposed an extension, pointing to the high cost.
So what we have now is basically a stalemate. Now, a recent House vote did see 17 Republicans join Democrats to pass an extension, but that bill faces really long odds in the Republican-controlled Senate, which has already voted down a similar bill. On top of that, former President Trump has also threatened to veto any measure like this, leaving the whole thing stuck in a political impasse.
Okay, so you've got millions of people facing these massive cost hikes, and you've got Washington completely deadlocked. What happens next? What are the long-term implications for the country?
This quote from the Urban Institute really zooms out and shows us the bigger picture. This isn't just about individual hardship. It's about the fact that if a big chunk of our working-age population can't get health care, that's bad for the entire economy. A less healthy workforce is, pretty simply, a less productive workforce.
You know, what this all really means is that for a little while there, it kind of felt like we'd figured out the whole coverage problem, and the debate had moved on to just controlling costs. But now, with these subsidies gone, that fundamental question of who gets covered is right back at the center of the national conversation.
And so all of this leaves us staring at one massive, essential question. As the price of healthcare just keeps climbing, the debate over who should pay for it, individuals, employers, or the government, is more urgent than ever. And the answer to that question is going to define the American healthcare system for years to come.